The effects of regenerative medicine are aimed at a complete cure. There's something called an erection score, and it's been significantly improved. There are actually quite a lot of people who develop ED due to the effects of diabetes. Hello everyone, this is Dr. Wakabayashi, also known as the Rejuvenation Doctor. Thank you for joining me again today. Today's video is directly about the concerns of middle-aged and older men, so I really hope everyone will watch it. The topic is, straight up, ED. Speaking of ED, I think it's probably the #1 issue in the sex lives of middle-aged and older men. For example, having trouble getting an erection, being too soft, or losing it halfway through. If any of these symptoms sound familiar to you, I really think you should watch today's video.
Doctor, when it comes to ED, I feel like if you just take Viagra or something, you can get and keep an erection. So isn't that good enough? What do you think about that?
Using medication to manage it is basically the standard course of treatment. But there are people who don't want to take the medication anymore because of side effects, or people who feel the medication has stopped working, or people whose ED isn't just caused by issues with the penis itself. Today, I'd like to talk about how regenerative medicine can help improve things for these 3 types of people.
First, could you briefly explain what ED is?
The penis is made up of a tissue called the corpus cavernosum, which is kind of like a sponge. Basically, when blood flows rapidly into this area, it becomes hard and enlarges. When blood flow doesn't gather, when the corpus cavernosum is damaged, or when the nerves in the corpus cavernosum are damaged, these 3 things declining are what cause the symptoms to appear.
When it comes to ED medication, I have the impression that it improves blood flow and causes an erection. Is that correct?
Yeah, that's right. But the issue here is, it's not just about blood flow. Some people have problems with the tissue of the corpus cavernosum, specifically the smooth muscle there, and others have nerve issues. When it comes to nerve problems, especially among middle-aged and older people, a lot of people develop ED due to the effects of diabetes.
So when ED medication doesn't work, it's not just about the blood vessels. Damage to the nerves or smooth muscle can also be the cause. So should we focus on fixing those areas instead?
That's right. Medication is kind of like doping. It's like pouring water into a bucket with holes in it. It's still just doping, after all. For those who want a fundamental solution, whose medication has stopped working, or who have other underlying causes, I'd really like to introduce regenerative medicine as an option.
Could you explain in more detail why regenerative medicine is effective for ED and how it can fundamentally improve the condition?
Sure. There are actually 2 types of regenerative medicine we're talking about today. The first is called stem cell therapy. One treatment involves extracting stem cells from abdominal fat, culturing them, and then administering them to the body. The other uses the stem cell culture supernatant, which is the fluid produced when culturing these stem cells. These 2 types of treatments have very similar effects, though. They work on 3 things: blood flow, the tissue of the corpus cavernosum, and nerves. First, both the stem cells and the stem cell culture supernatant contain cytokines called growth factors. Among them is VEG, which is a cytokine that greatly improves blood flow. As this continues to work, it promotes the formation of new blood vessels, which means you can expect improved blood flow as a result. Second, regarding the regeneration of corpus cavernosum tissue, it acts on the smooth muscle there. And as this tissue regenerates, it's kind of like loosening it up. Third, nerve regeneration. Nerves produce nitric oxide, NO. This nitric oxide transmits my signals, but with conditions like diabetes or after prostate surgery, this function declines. Here, a cytokine called NGF acts to repair the nerves, so you can expect a nerve repairing effect.
With this regenerative medicine treatment, honestly, how much can we expect it to help with erections?
According to medical data, when this stem cell treatment was given to patients after complete prostate removal, there was data showing that their erection scores improved. There are reports that administering stem cell supernatant has improved erection scores. Also, even in diabetic patients, after administering stem cells, there have been reports of improved morning erections, and overall improvement in erection scores as well. I think the effects of regenerative medicine are truly aimed at a fundamental cure.
Could you explain again the difference between medication and the effects of regenerative medicine?
Medication is actually a really good treatment option. Its biggest advantage is that it works quickly. However, when there is an underlying cause, the effects are quite limited. And of course, there's also the concern about side effects from taking medication over many years. As for stem cell therapy and stem cell supernatant therapy, These treatments are like repairing the holes in a leaky bucket. In terms of effectiveness, this is suitable for people who are worried about the side effects of medication and want to stop taking it, or for those for whom medication doesn't work. Or I think it's also suitable for people who have an underlying disease. When it comes to fundamental treatment for people with illnesses like diabetes, stem cell therapy is more appropriate. If it's just everyday age-related decline at that level, I think it's a good idea to first try stem cell-derived supernatant therapy.
When it comes to treating ED with stem cells or supernatant, what exactly does the treatment process look like?
There are two options, either administering it intravenously throughout the body or injecting it directly into the penis. The advantage of IV therapy is that if you have illnesses affecting your whole body, IV therapy is overwhelmingly more suitable in those cases. When it comes to local freeze, man, if you're really struggling with ED symptoms and your main hope is to do something about that specifically, I think it's better to inject it directly.
Just hearing about injecting directly into the penis sounds painful, isn't it?
We use a really thin needle for the injection. And in fact, most patients say it was much less of a big deal than they expected. Of course, it varies from person to person, so it's something you'll have to choose for yourself. But I think it's fair to say it's not as painful as you might imagine.
What can you tell me about the overall safety profile of this treatment and other related considerations?
There's often talk about the risk of cancer, but even when you look at various overseas data, the risk is actually quite low. Also, since the needle is inserted directly, there is a risk of damaging blood vessels, but that really depends on the skill of the doctor.
For example, after getting the injection, is it common to have a lot of swelling or anything like that? Or is it rare to have severe inflammation and pain?
Those kinds of things are actually pretty rare. Of course, we do monitor the progress, but it's not like something happens suddenly right after the injection.
I see. Another thing I'm worried about is, when it comes to stem cell culture supernatant, if you're using something derived from another person, is it really safe to put someone else's cells into your body?
There actually aren't any cells in the stem cell culture supernatant. For example, there's no risk of blockage, and the risk of causing an allergic reaction is actually quite low. So I think that's a bit of a misunderstanding. Of course, with any treatment, whenever you perform a medical procedure or introduce something into the body, there's always a chance of an allergic reaction. It's never zero. So I really want everyone to fully understand that point.
So, how effective has the treatment been for patients who have actually received it at this clinic?
We've actually had quite a few patients come in. There's something called an erection score, and we've seen significant improvement in that. A lot of patients say things like their erections have gotten harder, or that they've stopped experiencing mid-erection loss.
So it's about erectile strength improving with treatment. So does that mean you can keep improving that more and more over time?
That's right, of course. There are some people who finish after just one session, but generally, the more times you undergo the treatment, the more effective it becomes. Let me summarize what we talked about today. Today, we discussed ED and treatment options using regenerative medicine for those looking for alternatives to medication. Regenerative medicine treatments like stem cells and stem cell-derived supernatant therapy, a key feature is that it works on the three main causes of ED: blood flow, the tissue of the corpus cavernosum, and nerves. In particular, when it comes to stem cell therapy, it's suitable even for people with severe underlying conditions like diabetes, or those who have had prostate surgery, making it a treatment option that fits people with a variety of overall health conditions. Also, stem cell condition medium therapy is expected to have effects similar to those of stem cells, so it's a suitable treatment for people who want to try something first, or for those with mild ED. If you're struggling with ED and don't want to take medication, or if medication doesn't work for you, and for those who have other underlying causes like diabetes, I hope that after watching this video, you'll consider regenerative medicine. If you found today's video helpful, please give it a like and subscribe to